Hello, everyone. My name is Colleen Vincent, and I'm the Vice President of Community for the James Beard Foundation. Welcome to Farm Workers in the Food System, presented in partnership with Civil Eats. When we grocery shop, cook, or eat, we don't often consider the farm workers who made our meal possible and the many persistent challenges they face, especially in the light of COVID-19. Join Gosha Wozniacka, senior reporter for Civil Eats, as she leads a panel of crucial perspectives, including voices from Colombia Legal Services, Alianza Nacional de Campesinas, de Campesino A Campesino, and the James Beard Leadership Award-winning Coalition of Immokalee Workers. But first, how the webinar works. This webinar is being recorded, and we will send a link out with the recording after the program wraps. We'll save questions for the end as time allows. So please write your questions at any time using the webinar toolbar. If you're having technical difficulties, please message us in the webinar toolbar and we'll do what we can to troubleshoot. First, I'd like to welcome our moderator, Gosha Wozniacka. A multilingual journalist with more than 15 years of experience, Gosha is currently based in Oregon. She worked for 5 years as a staff reporter for the Associated Press in Fresno, California, and then in Portland, Oregon. She wrote extensively about agriculture, water, and other environmental issues, farm workers, and immigration policy. Prior to working at the AP, Wozniacka was the Immigration and Latino Affairs reporter for the Oregonian. She also co-runs a small, very small, urban farm with her partner. And now our guests, Carmen Obeso. Carmen is originally from Hermosillo, Sonora, Mexico, where she grew up and worked in agriculture from the age of 11. Ms. Obeso migrated to the United States 13 years ago and arrived in Oxnard, California. Since then, she has worked in agriculture, harvesting various crops, including strawberries, herbs, tomatoes, cucumbers, bell peppers, chiles, and others. For more than 6 years, Carmen has volunteered with the United Farm Workers Union and the United Farm Workers Foundation, and various other organizations supporting the fight for laws and benefits for farm workers like herself. In April 2020, Carmen and other farm workers created a project named De Campesinos a Campesinos, from farm workers to farm workers, to assist farm worker families in getting essential pantry and hygiene supplies. Her translator today is Diveli Perez. Our next guest is Gerardo Reyes Chávez. Gerardo is a senior staff member with award-winning human rights organization, the Coalition of Immokalee Workers. He is a farm worker and has worked in the field since age 11, first as a peasant farmer in Mexico, and then in the fields of Florida picking oranges, tomatoes, blueberries, and watermelon. He has worked with consumer allies to organize national actions in the campaign for fair food. As part of the implementation of that program, Mr. Reyes conducts workers' rights education with thousands of farm workers on participating tomato farms. Mr. Reyes speaks regularly about the Fair Food Program at events across the country in places such as Yale, the Harvard Law School, the Aspen Institute, Labor and Work-Life Program, convening on farm labor challenges, and the Interfaith Council on Corporate Responsibility's multi-stakeholder roundtable on ethical recruitment. The Aspen Institute named him a 2018 Ricardo Salinas Scholar. He co-presented at the TED-Med Chaos and Clarity Conference in Palm Springs, California. Our next guest is Andrea Schmidt. Andrea is a staff attorney at Colombia Legal Services, a Washington state nonprofit law firm that advocates for laws that advance social, economic, and racial equity for people living in poverty. She has spent most of her legal career litigating and pursuing legislative and administrative change for farm workers and other immigrant workers. Her advocacy has included supporting Familias Unidas por la Justicia, an independent farm worker union founded by indigenous families since its inception in 2013. Our next guest is Mily Treviño-Sauceda, who is the executive director and co-founder of Alianza Nacional de Campesinas, the first national grassroots farm worker women's organization. She is also known as the founder of the farm worker women's movement in the United States since the late 80s. She assists Líderes Campesinas as a member recruitment and orientation coordinator and co-founded Mujeres Mexicanas, Mexican Women in Coachella Valley. With the support of the CRLA Foundation, she then co-founded Líderes Campesinas in 1992, the first state-based farm workers women's grassroots organization. She earned a bachelor's degree in Chicano studies with enough credits for a minor in women's studies at Cal State Fullerton and a master's degree in social sciences, rural development, capacity building, women's leadership, and oral history at Antioch University. She sits on numerous state and national boards, as well as advisory councils. And our last but not least guest, Victoria Ruddy. Victoria is the Pacific Northwest Regional Director of United Farm Workers and is a longtime advocate for social justice for international workers. She has 7 years of experience in organizing workers in vulnerable industries and has organized farm workers in Oregon, Washington, and Idaho, and the maquiladora workers across the US-Mexico border for safe working conditions, fair wages, and essential benefits. She also co-founded and serves on the board of Partners for Responsible Trade, which is a charitable organization that provides scholarships and medical assistance to the families of maquiladora workers in northern Mexico. She has a master's degree in public administration from Franklin University and resides in Prosser, Washington, with her husband and 4 children. And now I am very pleased to turn the floor over to our moderator, Gosha Wozniacka.
Thank you, everyone, and thanks so much to everyone in the audience who's tuning in. I'm really glad to be moderating this important webinar. I'd like to welcome all of our panelists and especially Carmen Obeso. Thank you, Carmen, for sharing your experiences with us. And I also want to thank Diveli Perez, who is translating behind the scenes. I also encourage all of you in the audience to check out the previous 2 webinars in the Civil Eats James Beard Foundation series done by my colleagues Lisa Held and Nadra Niddle. They looked at the local food system as well as COVID impacts on communities of color. So those should be on the James Beard Foundation website. Now today we are going to be talking about farm workers in the food system and how they have been impacted by COVID-19. As you know, farm workers have been designated as essential workers, which is both a very important designation since they are in fact essential. Without them, we don't eat. But it's also kind of an ironic designation given how many of the workers are treated both by the government and by others. I've written since the start of the pandemic multiple stories looking at the impacts farm workers have faced with this virus. And unfortunately, the initial predictions have come true. We have hundreds of farm workers who have been tested positive for COVID-19 around the country, and probably numerous hundreds or thousands of others who have not been tested and who are COVID positive as well. And unfortunately, we have several people, several farm workers around the country who have died as a result of this horrible disease. Today, the hotspots, the biggest hotspots around the country, in fact, today are in agricultural areas, places like the Yakima Valley in Washington State, like the Willamette Valley in Oregon, like the Central Valley, Salinas Valley in California. Those are the places that have some of the highest COVID-19 rates right now. So this community is really getting very much impacted by the virus. Now, even before the pandemic came, farm workers are a population that face many, many challenges. Before the pandemic, they lived in very crowded conditions. They had low wages. They didn't have benefits. Many workers don't have health insurance or sick pay. They die of heat-related stress. They face many other injustices. And I think what COVID-19 really did is it highlighted those challenges. It kind of brought them to light, and it amplified many of them. It made many of them worse. And so this is our challenge today as a result. The other thing I think COVID did is it really shone a light on the efforts both by farm workers and by the various organizations that support them to organize and to help the workers, to better protect the workers, to uplift them, both right now during the pandemic and into the future. So these are the two things that I really would like our panel to focus on. On one hand, what are the challenges that workers are facing? And on the other hand, what are the solutions? What are various groups doing to help the workers? What can all of us do to help workers be better protected, and also to help solve some of these challenges right now and as we go forward once the pandemic hopefully winds down. So I would like to start with Mily Treviño-Sauceda, who leads an organization that focuses on farm worker women nationwide. Mily is also based in California, and California just released a initial results of a farm worker study, an in-depth study that did interviews with farm workers and looked at basically what the impacts of the pandemic are so far. And so I'm wondering if Mily, you can talk about this study and also what you're hearing from your various member organizations across the country.
Thank you, Gosha, and thank you to the James Beard Foundation for inviting myself and Carmen to be on this panel and to be with these wonderful people that I admire throughout, the time I've known about their work. So I know every single one of the organizations that they're representing, so I'm very honored to be here. So gracias. To start with, yes, knowing and the way we represent Farmworker women is that we are a 15-member organization member alliance, and we're representing in 11 different states in the United States, and some organizations are national and some are binational too. And all of them represent farm workers, and the focus, as long as they're providing focus with farm worker women, gender issues, then they're permitted to be part of the alliance. And this is how we're a grassroots organization, as Gosha had mentioned. And what we have been hearing all along throughout the year, every time that there are many more risks that farm workers are facing, and this pandemic has created additional challenges like Gosha was talking about that deal with the housing issues, the work related issues that are more that every time, I mean, workers know that they're against becoming ill, knowing and learning as they learn how bad the situation of this pandemic is creating in terms of illness. They continue risking their lives. Why? Because they know that this is the way that they can survive and support their families. At the same time, just in general, I want to say that farm workers and people who form the food system are an essential part of it. If farm workers, people that work in agriculture, are not able to work or prepare, cultivate, and work the plants and prepare them and harvest them, then the rest of the food system will not be able to function at all. And then there would be no food in our tables. So we've known all our lives that we have been essential, but we have never been treated as essentials. And so for the same reason, I just wanted to bring that up just as part of my conversation here, that farm workers are proud people that feel that the work that they're doing is not only supporting for them to be able to gain wages so that they can support their families, but at the same time they're proud to work the land, to work the earth, and to be connected with the earth. At the same time, understanding that they have to work with other workers, understanding that they have to work in situations that are really bad. They're most of the time, especially now, they're afraid to becoming sick because they know that most of the companies do not have health insurance, do not have, are not paying their time off if they get sick. So at times they don't want to be tested for many reasons. One of them, very, very hard to say, is they still don't trust agencies or certain clinics or hospitals, because they feel that all of these are connected with either law enforcement or connected directly with the ICE, which is the immigration that could be there to deport them. So we know that farm workers, there's a large number of farm workers, and I could say very, very just blunt that we have more than 65% of farm workers are undocumented. So they don't access, there's no way for them, if they're unemployed, to have any unemployment benefits. There's nothing like that. At the same time, as they work long hours, what happens when they try to go home? They live in many more times in substandard housing, or very crowded. Why? Because the rents are too high. At the same time, they have to co-live with other families to try to sustain their own. So when they get sick, there's no space for them to be able to where can they separate themselves so they don't get others sick. So there's a lot of vulnerabilities that are continuously happening with farm workers. At the same time, at the workplace, there is and bless their heart for companies that are doing this in terms of providing what they need in terms of the protective equipment, but we still have a great majority of companies that are not providing the social distancing, the equipment that they need for them to avoid being ill. And as Gosha was just saying, here in California, the California Institute for Rural Studies, which is a great group of scientists and experts that have joined with some of our organizations, from Alianza and myself and some staff from Alianza. We have worked with preparing and working on a study, and Líderes Campesinas from our local state here in California helped in terms of with other great groups, farmer groups. It was a participatory survey that was done to interview farm workers and find out what has been happening with them during the time of COVID. And it wasn't surprising for most of us that the issues that were happening there was what I just said. Workers are constantly afraid, but they know that they're essential. They know they have to work. They know that it's seasonal work, and at times it's very hard for them to say, oh, today I'm not going to go because I'm afraid. I have, to the contrary, they're thinking constantly about in what way they can make sure that they have a job to be able to sustain their family. What we did find out, separate from that survey throughout the United States, in interviews, we have more than 125, more than 130 interviews that we've done with farm workers from Florida, New York, different states that we are in, especially California, from Oregon, and from a state of Washington, where the women, especially women, are saying, I have to at times decide either to go to work or stay and take care of my children, or leave my children with the oldest one, which might be 10 years old or 11 years old, or bring my children with me to work. Those are risks that women are doing just because they know it's a matter of survival, and they know that right now daycare centers are closed, the schools were not there for them, and it was so hard for them to even try to adjust, but at the same time, they're trying to survive this. There's a lot of depression that's been happening. And I think we need to work on getting studies around that, because we have been finding out that even children of farm workers are committing suicide or are on the verge of committing suicide. And it's so depressing in terms of things that are happening, but the services are not there because of what's going on in general. Just to finalize, I do want to go back in terms of the study. The study does show that, at least when it started full in terms of here in California, it was shown that between April, May, June, there was a decrease in unemployment of farm workers when comparing it from the past 3 years. It showed that instead of in the past 3 years, it would be growing because of the seasons, the harvest is happening here in California. Instead, it started decreasing. What did that mean? That many workers ended up owing rent, not having enough. Us finding while we were doing taking out the bags of food to families in their homes, that we found many families that they didn't have food for the last like 2 to 3 days, and then children not having milk for them to be able to drink that milk. And it's so demoralizing at times, knowing that there are food banks, but they're too far away from workers because they don't have transportation at times to get there. And I want to stop here because I know I can go on and on and on, and I know that there's a good group of people that have a lot to offer, but I'd be more than willing to answer some questions after this. Thank you.
Thank you, Mily. Thank you so much. One of the things that you mentioned that we'd like to expand on is you talked about the testing aspect and how many farm workers don't trust various agencies or even healthcare providers because they're afraid that maybe it's connected to immigration officials, or it could impact them in some ways. Gerardo, in Florida, where the Coalition for Immokalee Workers is based, your group has worked really hard to get a testing site in Immokalee. Can you talk a little bit about that process and some of these challenges that you're faced now once you have this site in place? Gerardo? Yeah, we can't hear you.
Okay, I was muted. I didn't mute it.
Okay.
I just wanted to, yeah, in regards to the fight that we are leading from Immokalee, we started to sound the alarm in the mid of March. We started to talk among ourselves and then contact some people that we knew to start to talk about, how to work together with local authorities, with the Department of Health, assuming that they would find it as a plus, as a way of being able to more effectively create plans and work them out to protect the community. We were wrong, and we very quickly realized that we needed to start a campaign for that purpose. So we started by sending a letter. After several attempts at communicating, we sent a letter to the governor and the commissioners here in Collier County. And we needed more than 40,000 signatures and more than 120 organizations to sign onto this letter, demanding a few things, demanding that we should have testing available. A field hospital was the original idea because we don't have a hospital here in town. The closest hospital is 40 minutes away to an hour, depending on traffic. People don't have transportation. People here go to work in buses that hold 30, 40 workers, so it's impossible to observe social distancing. We live overcrowded also, as a community. There's mobile trailer parks, mobile homes that hold 6, 8, 10, 12 workers sometimes. And all of this creates a reality where the recommendations of social distancing makes no sense. That without mentioning some of the things that were mentioned by Mily in regards to people being afraid, people not trusting necessarily the authorities, and not having the resources even to be able to isolate if they were, for example, exposed to somebody that tested positive for COVID-19. All of these things brought us to do this campaign, and it took about a month before the governor finally responded. All the month of April, we were asking for testing. We were asking for a plan in regards to contact tracing, for spaces for people to observe that quarantine or isolate if they tested positive but didn't have the symptoms that needed to be going to a hospital. And also we were asking for facilities. In the long term, that's going to be still something that we're going to need the government to do. So far, the response was that in May, after a month of campaigning, we were able to get 3 days of testing with close to 1,500 tests that were taken by the community in May 3rd, 4th, and 5th. But after that, it went down again, it decreased, and there was not a lot of chances for people to go and get tested because they were not appropriate with the times in which people were coming back from work. And the general sense was that the Department of Health was trying to delay that process and wait for the season, the harvesting season to end, which ends around midst of May. So right now, there's people are working in different states like Georgia, South Carolina, all over the East Coast, and they are gonna start to come back. Some people are coming back slowly. Some people will be coming back for the beginning of the season in November. So by October, everybody's back. In September, a lot of people are coming back, and we are still fighting for the same basic things, access to testing, contact tracing, to the point in which we actually received the first response to our demands, not from the Department of Health in regards to the testing being made available at the beginning of May, but the response came from Doctors Without Borders, who answered the call and came here to help with testing. They had limited testing, and there was a week and a half in which testing was not even available. Now, the labs that the state was working with were taking about 2 weeks, 12 days to 2 weeks, rendering the testing absolutely not useful. After 2 weeks, it makes no sense. So right now that has changed, but all of these have been created because of the pressure that we as a community started to exert along with allies across the country. And we need to keep fighting. And it's just absolutely sad, to see how members of our community are losing their lives at the same time that we see the lack of approaches that make sense, that are aiming to take care of the community. We hear that we are, or the jobs that we do at least are considered essential, but at the end of the day, we are treated as if we are disposable because we're not offered any kind of support, economic support. We are not offered the personal protective equipment that's needed. We are not even, offer any kind of alternative where you're just expected to go out and feed the nation while receiving wages that are stagnant, while having to risk our lives. And that needs to change, because we also deserve to be treated as essential. We hear about how people honor the jobs that workers in hospitals, doctors, nurses, all the workers that makes it possible for those institutions to work, receive the recognition at 7 p.m. People clap for them, and that is great. That we are conscious of that, but we forget that there is people that are feeding us, that are asking for something even much more basic, the ability to be safe while doing the work. So I'm going to stop there for now, because I know that there's more to be said.
Yeah, absolutely. And I think, it's incredible that you have to fight so much just to get some tests for this group of people that clearly need to get them. And the fact that workers are migrating from state to state, and then they're coming back, to Florida or to other states. This makes it even more crucial to have them tested, because they are potentially, able to get infected in other areas or bring the infections back home. And so it's really, really important to get that testing to them. Now, I also want to talk about another type of farm workers that we don't always have in mind when we talk about farm workers, which is this temporary visa program that has been growing really, really fast over the past decade. These are called H-2A visas, and these farm workers essentially come from Mexico mostly, and from other countries as well. And they live on labor camps, which are employer provided. And they're pretty isolated in these labor camps, so they don't migrate. They don't have much contact with the community other than going to the local grocery store. And so these workers, they face some of the similar challenges, but they also have some distinct challenges when it comes to the pandemic. And Victoria Ruddy with the UFW, you visited these labor camps as well as isolation camps for COVID-19 at Gibbers Farms this month. Can you tell us a little bit about what you saw and what specifically these workers are facing who are on H-2A visas here?
Yeah, thanks, Gosha, and thanks to the Beard Foundation for having us participate in the panel. It's an honor to be with all of these amazing farm worker advocates today. I just want to mention that, farm workers have always been essential. And as a result of the COVID-19 pandemic, they're finally being recognized as being essential. Unfortunately, they're still not being treated as if they're essential. And I live here in the Yakima Valley, in the lower Yakima Valley, and we've been dealing with this now for months. It started in the packing houses, the processing plants. We had a huge outbreak at the Tyson plant in Wallula. 300 workers, close to 300 workers tested positive. Three workers died as a result of being exposed at that plant. And then as the cherry harvest started in June, we started to see the bigger outbreaks in the fields and the farms. And what we were seeing is that even as we were able to get rules for farm workers, there was no way to really enforce them. There was no compliance. We filed dozens of complaints with labor and industries, and to this date, no substantial sanctions have been taken against any of those employers. And the situation we're dealing with now is one of the biggest outbreaks we've seen in agriculture in Washington State, which is at Gebbers Farms in Okanogan County. And we have been visiting the labor camps, the isolation camps there, where they're sending symptomatic workers. And I've also been speaking with workers here and workers who've already fled back to Mexico. And we've also been talking with grieving spouses and siblings and parents who have lost their loved ones who were here in the United States working for Gebbers Farms. Two H-2A workers have died. They died in July after being exposed to COVID-19 at the farm. Juan Carlos Rincon and Earl Edwards. Juan Carlos was from Querétaro, Mexico, and Earl Edwards was from Jamaica. They both were longtime employees of Brewster's, and they were working here harvesting cherries when they got sick. Both of them died in an isolation camp in the middle of nowhere, out in a field by themselves without ever having seen a doctor. And at these labor camps, when I visited, I heard horror stories and fear from workers as they told me about how hundreds of workers were getting sick. And many of them were not tested, and even fewer of them ever saw a doctor or had any sort of medical attention. They were housed in small cabins, and the two-person cabins out in really isolated areas. They didn't have any Wi-Fi. There was no cell phone signal out there, no vehicle, no landline, and they were really scared to be left there. When Juan Carlos died, the company didn't even want to provide funding to send his ashes home to his family. And workers told me about their experience of basically passing a hat around the camp, and they collected over $3,000 to be able to send him home to his family in Mexico. And it's really a dire situation because of the fact that H-2A workers are almost completely dependent on their employer, not only for employment, but for transportation and for housing. And at the same time, they work under an immense fear and threat of retaliation. And so they're really terrified to not come back the next year. These visas are so important to them, and their families depend on the funds that they make while they're working here. And so it's really hard for them to speak up and talk about what's happening at the farms. At Gebers, the workers had no access to medical care, so they're isolated. They have no transportation. They don't know the language. They just can't reach a doctor, and they need their employer to step in. And in this case, they didn't. 2 workers died alone in an isolation camp without ever seeing a doctor. And many of the workers who lived and worked with Juan Carlos have returned to Mexico since that happened. And it's not an easy decision for an H-2A worker to give up their visa and their employment, knowing that they're going to be blacklisted and not invited back. These workers were literally fleeing for their lives. I mean, they were scared to die in an isolation camp. And the governor of Washington has since been actively involved, but it's still proven difficult to compel compliance at these farms. And I just want to reiterate that, no one should die in an isolation camp by themselves without medical attention. And what's really upsetting in this case is that it didn't just happen one time, it happened twice at the same farm. And the cherry harvest literally cost these 2 men their lives, and the company basically didn't even stop to notice.
Thank you, Victoria. We appreciate you sharing that experience and that visiting those camps and bearing witness to that. Now I'd like to turn to Carmen. Carmen, you probably can relate to a few of these, but your experience as a worker who has lived here in the United States for many years. Can you tell us a little bit about how the pandemic affected you and your work and your family?
Yes. Well, ever since the situation began, we were scared of being infected. And I carried disinfectant in my car because I was scared of being infected, because my work consists of checking the quality of the strawberries. So I was one of the people that had more contact with others. and I felt the risk very close to me. So this was a situation that I lived through, and that's why I asked that social distancing be implemented, because I was scared of being infected and bringing this disease to my kids and the rest of the people who I live with. This is a difficult situation for all of us, but we had to work, because as a farm worker, we don't have an option to stay home because we're not eligible for unemployment benefits. And if we don't work, we don't eat, we can't pay our rent. And it's very difficult because our landlords also depend on the rent that we pay to them. And it's been a very difficult situation, especially when we began to see that there were no groceries in stores. And we were also very afraid to demand social distancing. I pretty much spoke for my coworkers, and because they were more afraid, they're more afraid of demanding their rights. By demanding my rights, they did grant me social distancing, and they sent me to a different place where I did the same thing and I earned the same wage, but with less people. And more people were in the same situation. But a lot of them didn't believe in this situation. And the foreman even made fun of us. And once you start demanding your rights, you become fearful of making a mistake, because then they have a reason to fire you. Because this is what happens in the fields when you demand your rights. They start seeing you as a problematic person. And they even try to keep you from talking to other people about this. And they see it as a threat that when we know our rights. And I was isolated from people. One of the incidents that I suffered was that I was exposed to a pesticide. And I also had another incident where I was sent to do a different job than everybody else. And the workload was heavier. And I injured my shoulder, and right now I am injured. And I haven't been able to work because there's no work that I am able to do at this time.
So essentially, Carmen, they retaliated against you, and as a result, you were injured, and now you're without employment.
Yes, this is the case. And this led me to be suffering this. And I'm thinking that had I kept my job and had they implemented the safety measures, this wouldn't have happened to me.
Thank you for sharing your experiences, Carmen. I really appreciate it. I think your experiences speak to the fact of how important it is that various farm worker unions and other organizations are fighting so hard to improve these protections and to keep employers responsible and to actually enforce the very few policies and rules that have come out regarding protecting workers. I want to turn to Andrea Schmidt. Andrea, you are an attorney in Washington State, and you helped farm worker unions file several lawsuits in Washington to help improve these protections. Can you tell us briefly about these lawsuits and what they've resulted in?
Sure. Thank you for having me. So I want to put all of this in the context of, in a larger historical context, which is that farm workers, as many people on this call already know, but some might not, have a history of being left out of protections in the workplace. So, don't get overtime almost anywhere, are excluded from collective bargaining almost everywhere. In many places still don't have minimum wage, workers' compensation, unemployment protections. And these are all exclusions that have a racist history. And so when we saw this pandemic coming, we knew that it would be terribly bad for farm workers. And we knew that even in a place like Washington, where we have democratic leadership and better than average protections for most workers, we were still going to have to fight to get people protected. And so it's interesting, the parallel, Gerardo mentioned that they started alerting the governor in mid-March as to the coming problems. We did the same in mid-March. We wrote a letter to the governor saying, this is going to be terrible. You're going to have problems in housing, transportation, workplaces for farm workers. The response we got was just really unfocused. There was a lack of urgency. The state was posed to issue some really vague guidelines that seemed to us to be unenforceable. And so in the lawsuits we're talking about, I represented Familias Unidas por la Justicia, which is a farm worker union that's based in the Skagit Valley in Washington. We sued demanding that the state make enforceable regulations in those areas that I listed. And in the case, the judge actually never ruled, but he set a review hearing, which means he said to the state, essentially, I want to hear from you again in 2 weeks and see what has improved. And in that time, the state promulgated housing rules, and the governor committed to putting out a proclamation on workplace and transportation standards, which he did eventually do. And so we consider that lawsuit a success. And then my client, Familias Unidas, was still not satisfied with the content of the housing rules. There were some really glaring deficiencies there. And I want to say, these are better than average protections again across the country. And this is just a real testament to the lack of protections nationwide. Our housing rules still had deficiencies in the amount of space given to people, still allowed people to be forced to sleep in bunk beds in most circumstances, and really did absolutely nothing about ventilation, which is a huge issue. We did not prevail in that second case. It's a really, really difficult legal standard when you're trying to challenge rules that are made by a state agency. And so the court didn't find that they had been completely unreasoning in their approach to those rules. But the rules themselves are still not good. And one of the real key factors there is that, as you all likely know, there's more evidence all the time that this virus is transmitted by aerosol particles, which are tiny little particles that stay airborne for a long time. Those are not limited to a 6-foot distance. They float around in the air for 20 or more feet. And that means that the 6 feet distancing doesn't matter in enclosed spaces where people are staying for prolonged times. So sleeping, for example. And what we need is for the state to really deal with ventilation in a clear and enforceable way. And we're, my client Familias Unidas is not going to stop asking for real protections for folks in farm worker housing, so that people aren't exposed and don't end up dying alone, as Victoria said, in labor camps of this disease.
Thank you, Andrea. I want to briefly go back to Gerardo. Gerardo, CIW is known for the Fair Foods Program, which is a partnership between farm workers, growers, and corporations. Can you talk briefly about how this program has helped you during the pandemic and how it can help in the future with other crises?
The Fair Food Program has been the alternative to actually deal with the issues that, in a normal setting, a farm worker would not be able to. We have seen both what happens inside participating farms and outside of participating farms. Under the Fair Food Program, we have 14 agreements with corporations like Taco Bell, McDonald's, Subway, even Walmart is part of this agreement. It represents about 20% of the market. And with that power, we have been able to create the program, which includes protections in regards to health and safety, among other things, including the elimination of sexual harassment and sexual assault from the fields, the elimination of modern day slavery. Also, we have been fighting for many, many years against that. And the also economic side of it, corporations pay a premium that since 2011 until today has led to the distribution of more than $35 million among farm workers in 90% of the tomato industry that is based in Florida. We expanded these protections to 6 other states up the East Coast due to the agreement with Walmart. And in the specific issue around health and safety, we have been able to collaborate, to work directly with these growers because of this partnership that has been working since 2011 in regards to the prevention and mitigation of the COVID-19 propagation in our community. And specifically, we started to work with one of the growers, Lipman, whom facilitated 7 industrial hand washing stations that were distributed in the places where people go to look for work in the mornings, regardless of where they work. People work in construction and landscaping. So these stations were provided by them, maintained in part by us, by the Department of Health, the fire department. So it was a collaboration that was only possible because of these agreements, because of the power of the market through legally binding agreements that bring this partnership to be a reality. Along with this, there is an ongoing conversation, and there's been changes that are going to be applying, other changes that are on a conversation, ongoing conversation about protocols that are going to be part of how things are dealt with. If there is an instance in the future, we're thinking beyond this moment. But as it is now, concretely, some farms have done more than the government itself, more than the Department of Health itself. Some companies have, for example, bring workers, take the plans to bring workers, to bring food for workers from the grocery store by sending a bus driver to bring all the food that all the workers need, instead of having the workers go in and do multiple trips to the store, which means more exposure. In the housing where they are providing, they also are dedicating, those companies who own housing and provide to the workers, they are providing housing for workers that might come back with symptoms or test positive. And they are also working to be able to test the workers in the different farms, the different operations they have. They are also dedicating more transportation so the workers can observe a little bit of social distancing while transported to work and from the work back home. and sanitizing constantly the bosses, offering hand sanitizer wherever the workers are. There's shade in the fields for people that provides all of these things for them. It is not perfect, and it is not the last thing that we're gonna see. This is going to bring much more changes due to this partnership, because ultimately, I think what is missing in the farm worker community is the power that needs to be created for workers to be able to decide what's better for them. And through the power of the market and the implementation of the Fair Food Program, we have been able to bring unprecedented changes and to have a place on the table to talk about all of these issues that we are confronting right now around COVID-19. So aside or along with that, as a community, we have organized, there's a women's group that have been sewing masks since the beginning and continue to do so. The distribution of those masks have happened in participating farms. We have absolute access to those farms because of those agreements. And also in the community, we have been visiting different mobile home parks to talk to the community and deliver a little bit of protection while we continue the fight to bring the government to do what's necessary. We have been partnering with Doctors Without Borders. They were here. While they were here, they said that it was 35% in one of the months that they measured, 35% rate of infection. That's how fast it was spreading in our community. Right now, Partners in Health, another organization that are experts in their field in contact tracing, have been offering their help to the Department of Health here in our county. And we have not received yet an okay for them to start working and supporting for free the Department of Health here. So that's one of the things that we're trying to do. We're offering everything we have to be able to protect our community. And we are going to continue fighting. And for that, I want to invite people to take the time and visit our website for COVID-19, the campaign for COVID-19, because we are going to be posting more and more things, ways in which people can participate in Immokalee COVID-19 .org. And also, you know, if people want to support and empower workers, try to support initiatives that make sense, that empower workers in the fields, like the Fair Food Program. We're aiming to expand this by bringing more corporations. We currently have a boycott of Wendy's, and we are expecting Wendy's to do better by their workers by joining onto the Fair Food Program. And lastly, I want to invite people to get informed about these kinds of programs by visiting a site in which people can learn from a report, a research that came out from the MSI Integrity, which is something that was being organized by Harvard for the past 10 years, analyzing what works and what doesn't in regards to social responsibility around different approaches for workers in different sectors. So if you want to visit that, the model that we created, which we call Worker-Driven Social Responsibility Model, or WSR, it's future as one that actually delivers changes, concrete changes in which people can actually also get involved in supporting. Thanks.
Thank you, Gerardo. We're running out of time, but I'd like to briefly go to Carmen once more and ask her if she can talk about the initiative that she created to help support her fellow farm workers. Diveli? Looks like we're having an audio issue.
Yes, can you hear me?
Yes.
Yes, we can hear you.
Okay. during this pandemic, we were seeing that we didn't have the opportunity to get to supermarkets on time in order to find
You're on mute.
Diveli.
Yes, sorry, I was speaking to Carmen because she asked me if I could hear her.
Okay, continue.
I can't hear. Carmen. No. When the pandemic began, my colleagues and I were seeing that we didn't have access to food and to basic food that we needed in supermarkets. They began to distribute groceries in certain places, but once we were out of work, they were out, so there was nothing for us. And these donations that they were making were carried out very early in the morning, so we were not able to go. So we were a group of farm workers who were supported by several organizations like Rural Coalition, Alianza. And we began this project and we began to solicit donations. And we provided our gloves, our disinfectants, and our gasoline in order to gather donations. And we began to distribute groceries. And we, like us, the farm workers, have been doing this every week. And it varies because it depends on what we gather every week. But we help around 300 families. We're distributing fruits and vegetables, toiletries, and we have access to all of these items through donations. And we've also raised some money. And we also cook burritos and tortas, and we distribute them. And we distribute them among farm workers. And we have had a good response from the community who have been joining us in this cause. And this is all volunteer based. Nobody pays us. The only benefit that we have is that we have access to groceries. And it's very, very fulfilling because this is something that I have been doing this for years. I have been working with the United Farm Workers. And we began this project and we want to continue because we know there's a high need right now. We know that people aren't working. And the amount of work is very scarce. And there are people who are still working because they have needs to fulfill. So thank you for allowing me to express what we are doing.
Thank you, Carmen. We really appreciate you, and thank you for feeding all of us, and thank you to your fellow farm workers as well. I think it's clear from what everyone has said today that farm workers really are facing a lot of challenges during this time. The fear, the lack of food, even just basic things like that. And so it's so incredibly important that all of us can support the workers, either directly or indirectly, by supporting these wonderful organizations that are working to advocate on their behalf, so that we can really uplift the workers and make them the essential people that they are in our lives. So thank you, everybody, for joining us. Thank you to our wonderful panelists. I wish we had many more hours to talk about this important issue, but feel free to go to these websites and check out the work that they are doing. So we appreciate all of you, and thanks for tuning in.
Yes, thank you so much to Gosha for moderating, for all of our incredible panelists for providing your unique perspective on this situation. And thank you, of course, to all of our audience members who tuned in to check it out. We're so grateful to be working with Civil Eats on this series that we've been doing. It's been absolutely fantastic so far. If you really got a lot out of this panel, keep an eye on the industry support webinars on the James Beard Foundation website. And a especially special thanks to Carmen and Diveli for this incredible translation we were able to do. It was such an honor to be able to get Carmen to be a part of this. And Diveli, you made that possible. So thank you especially to both of you, and to Gosha and everyone. So everyone have a safe, wonderful rest of your day. Thank you.
Thank you.
Bye. Thank you.
I'm gonna desconect.